Judith Mujica travels from Venezuela into Colombia. She's 4 months pregnant with her third child. Those who need medical help are a constant sight here at the border. Every day, thousands of Venezuelans cross into Colombia, some in search of money, some in search of a little food, perhaps a new life. Increasingly, Venezuelans are also traveling into Colombia in search of medicines they desperately need that they say they can no longer find back home. Judith goes to this health post, run by UN child rights advocate UNICEF. All her medical checkups are now in Colombia. The doctor tells her that she needs to get to a hospital now. We give her a ride. She says that Venezuela's healthcare system has collapsed.
There are no resources for the health service. I went to the hospital yesterday in Venezuela, and the doctor was sleeping, and they didn't want to wake him up.
She waited 3 hours to be seen before she left with no checkup. If she hadn't come to Colombia, she fears her hypertension wouldn't have been detected.
In the middle of the country, you can't live. If you eat, that's all you can do. If you buy shoes, you can't eat.
The collapse of the Venezuelan economy has meant diseases that were once eradicated have crept back, like malaria and measles. Other pregnant Venezuelan mothers have stayed in Colombia to work and receive healthcare services. Alejandra Vera is director of the NGO Report and Act. She works with vulnerable women, like prostitutes. She hands out condoms, birth control, and pregnancy tests.
In Venezuela, the situation is very tough. There's no way of getting contraception or condoms. What this all means is unwanted pregnancies and more sexually transmitted diseases.
Some of these women charge as little as $2 for sex. Judith returns home after her visit to the hospital. A car carries another Venezuelan who sought medical treatment in Colombia. For the 45-year-old man, it was too late. Life and death on the border. Toby Muse, CGTN, the Colombian-Venezuelan border.